Welcome to The Explainer. If you're here today, there's a good chance you're facing something completely unexpected and, let's be honest, incredibly overwhelming: finding long-term care for an aging parent. You've probably never even had to think about this before, right? But here you are. It is a massive responsibility, but I promise you, you are in the exact right place. We're going to break this whole thing down together so you can make the absolute best, most informed choice possible.
You know the signs: the unpaid bills piling up on the counter, that burned pot left sitting on the stove, or maybe it's the exact same story she's told you for the third time today. Maybe you got a sudden call from a hospital discharge planner, or maybe it wasn't one single catastrophic event at all. It was just 1,000 tiny stressful moments that have gathered at your kitchen table late at night. Suddenly, words that were just background noise to you before, like assisted living and memory care, are front and center. It's such an agonizing place to be. But hey, take a deep breath. Let's dive into this together.
So here's our roadmap for today. We're going to systematically unpack all that confusing jargon for you. First, defining assisted living, then defining memory care. Number 3, we'll do a side-by-side comparison. 4, we'll look at transitions and financial realities. And finally, number 5, taking your next steps.
All right, part 1, defining assisted living, the supportive bridge. This is probably the term you hear tossed around the most. Just think of assisted living as a supportive bridge for seniors. Picture a dad who is still sharp as a tack, right? But maybe he's getting a little frail, maybe he's had a couple of falls. He can't safely live completely on his own anymore, but he absolutely doesn't need 24-hour skilled nursing care.
The whole core of the assisted living model revolves around something called ADLs, or activities of daily living. Basically, these are just the fundamental tasks of self-care we all do every single day without thinking. Bathing, getting dressed, managing medications, moving around safely, using the restroom. Assisted living is literally just about providing a helping hand with those specific tasks. They also take care of instrumental chores, think cooking, cleaning the apartment, doing laundry, or arranging a ride to the doctor. The main goal here? To provide a safety net while letting the resident keep as much of their independence as humanly possible.
So what does that actual lifestyle look like day to day? Well, the environment is intentionally designed to feel like a home, totally not a hospital. And they usually offer private or semi-private apartments. What's super important here is the real emphasis on community. There's a flexible daily calendar packed with social events. We're talking exercise classes, card games, movie nights. It's honestly fantastic for seniors whose minds are still sharp and who just crave some good companionship. Also, as a quick side note, in California, these facilities are officially licensed as a residential care facility for the elderly, or RCFE, by the California Department of Social Services.
Which brings us to Section 2. Defining memory care, specialized cognitive support. Now, people love to use the terms assisted living and memory care interchangeably, but they are absolutely not the same thing. Memory care is not just assisted living with a fancy new name. It is a distinct, highly specialized form of care designed specifically for folks living with Alzheimer's disease or other progressive forms of dementia. The core difference really boils down to this one idea. While assisted living supports the body, a memory care community supports the mind. It's a profound shift. A memory care community is built completely from the ground up, both physically and philosophically, for someone whose cognitive impairment has progressed to the point where their safety is the absolute primary concern.
So how does that actually play out in the real world? First off, memory care features secured environments. Wandering is a very common and dangerous symptom of dementia, so doors have keypads and courtyards are fully enclosed to keep residents safe. The staff there receives specialized, ongoing dementia training so they know exactly how to compassionately manage challenging behaviors and gently de-escalate anxiety. Even the physical spaces are simplified. You might see circular hallways so a resident doesn't get frustrated hitting a dead end, or little memory boxes outside their doors with personal items to help them identify their room. And lastly, the daily routine isn't just a list of flexible, optional things to do. It's structured, it's therapeutic. Activities like music and reminiscence therapy are specifically meant to validate their reality and spark genuine moments of joy and connection, rather than just keeping them busy.
All right, let's put these concepts to the test. In Section 3, a side-by-side comparison, evaluating the differences. It is incredibly helpful to put these two RCFE licensed options right next to each other to give you a really practical framework for making a decision. When you look at them side by side like this, the differences are totally night and day. For the resident profile, assisted living is for someone needing physical support who is still cognitively aware. But memory care? That's for cognitive support, where safety is literally number one. How about the environment? Assisted living is an open, accessibility-focused community versus a secured, simplified environment to minimize confusion and memory care. Then there's the staff. In assisted living, they're acting as caregivers and companions. In memory care, you're looking at extensive dementia training and a significantly higher staff-to-resident ratio. And finally, daily life shifts from those flexible, optional recreational activities we talked about to highly structured, routine-based, therapeutic activities.
If you take away just one single thing from this comparison, let it be this. Assisted living is a service model. Memory care is a clinical model wrapped up in a service environment. And because of those higher staffing ratios, the intensive specialized training, and that strict security, memory care is almost always going to be the more expensive option.
Okay, moving on to Section 4, Transitions and Financial Realities. This is where we directly tackle the two absolute biggest anxieties families face. What happens when a parent's health declines? And how in the world do we actually pay for all of this?
It is super common for a senior to start out in assisted living and then later transition over to memory care. In fact, lots of continuing care retirement communities are built specifically to handle this. But what actually triggers that move? A facility's wellness director is going to look for a few key things: an increase in wandering or exit-seeking behaviors, a major cognitive decline that stops them from participating in basic daily life, increased agitation, anxiety, or disruptive confusion, or a severe drop-off in their personal hygiene routines. The transition itself is designed to be as seamless as possible. And just so you know, organizations like the Long-Term Care Ombudsman Program can step in to act as your advocate during this really sensitive time.
Now for the crucial part, clarifying those strict financial realities. Look, Medicare is a federal program that pays for short-term skilled rehab. But, and this shocks so many people, it absolutely does not pay for long-term custodial care. Meaning, no, it will not pay for room and board at these facilities. Families are almost always stunned to learn this right when they need the care the most. Medi-Cal, on the other hand, is a state program. Through the Department of Healthcare Services, the Assisted Living Waiver, or ALW, can be a total lifeline. It can help pay for the care portion of the bill for eligible folks, though you still cover room and board with your own income. Just keep in mind, you have to apply early for this, because the waiver almost always has a massive wait list. Let's bring it home with Section 5, taking your next steps. Finding a facility is incredibly overwhelming, so we're going to break this down into actionable micro steps right now to empower you to take control. This is the million-dollar question, right? How do I choose the right one for my parent? Well, choosing between assisted living and memory care doesn't actually start with driving around doing facility tours. It starts with a thorough, honest, and completely professional medical assessment of your parent's current condition. Ideally, you really want to consult a geriatrician for a formal cognitive screening. Getting a firm grip on that medical reality is the foundation for literally everything else. Once you have that medical reality squared away, then you start touring. I want you to think of this phase as giving yourself full permission to be a detective. Seriously, don't just sit there and listen to the slick marketing pitch. Observe. Look at the staff interactions. Are they patient? Are they kind? Are they making eye contact when they de-escalate an upset resident? Use your senses. Does the environment feel calm and pleasant, or is it chaotic, loud, and totally overstimulating? Ask the administration directly. How frequently does your staff actually receive dementia training? And check if that activity calendar on the wall is truly tailored and therapeutic, and not just the standard assisted living calendar pinned up in a different hallway. To keep you from falling into total decision paralysis, I just want you to focus on this exact action plan for this week. Just these 4 small, totally doable steps. Step 1. Schedule a doctor's appointment for a cognitive screening. Step 2, start a simple log noting the dates and times of any concerning behaviors. Doctors love this data, it's invaluable. Step 3, window shop online using the CDSS's Find a Licensed Care Facility tool. Pop in your zip code and just get a feel for the landscape. And Step 4, visit the California Care Compass website to print out their full tour checklist. As we wrap up today, I really want you to consider this quote. Choosing the right environment is not about giving up, it is an act of profound love. I know it so often feels like a massive admission of defeat to move a parent into a care facility, but I really encourage you to emotionally reframe this agonizing decision. You are not failing them. You are taking a loving, proactive step to ensure your parent is safe, respected, and experiencing true moments of joy and dignity, no matter what the state of their health might be. Coming up next, decoding the RCFE license. What does it actually guarantee? We talked a lot today about that residential care facility for the elderly license, but what does it really mean? What safety standards does it actually guarantee for your loved one? And just as importantly, what protections does it leave out entirely? We're going to break down all those regulations in our next explainer. Until then, take a really deep breath, tackle your action plan for the week, and thank you so much for seeking out the knowledge you need to care for the ones you love.